On this episode of NorCal News Now, we're chatting with David Welch, a retired RN, member of the California Nurses Association, and trustee at North State Labor Federation AFL-CIO. I'm your host, Mike Richman, and as you will see, I am not in the studio today. We are practicing extreme social distancing. In fact, I'm about 3,000 miles away from Chico in southern Florida, taking care of my folks, trying to do a little caregiving here in southern Florida. So I am here, and Aaron, you are there with David. How you doing?
Doing good, Mike. How's it? I heard it's a little warm down there.
It's nice. It's 76 degrees. It's comfortable, but the people are crazy. People are nuts. I've been talking to friends and family back in Chico, and it seems like everybody's much more chill in Chico than they are down here. I mean, it's like panic time down here.
Oh, we got that.
It's crazy.
We got that California calm out here, man. Yeah.
I miss it.
Well, yeah, thank you, Mike. I'm Aaron Haar, and we appreciate you joining us for this special episode. Wanted to take some time out of our day to kind of have a public service address to people out there. We brought in a friend of the show and a long-term colleague here in the Nursing Association. So we brought on David Welch to help us figure out how we can protect ourselves, our family, and our community in this time. So David, we appreciate you being here.
Happy to be here.
So tell us a little bit about the latest, I guess, 48 hours and kind of some of the things that have come on with the virus, and as far as our local community, what we need to do to prepare.
Well, I think that what we're seeing locally increasingly is extremely appropriate, both locally and statewide, and now beginning finally to be really nationally appropriate, where we're taking this thing as seriously as we need to, hopefully. I think it's real clear that this is indeed a very serious epidemic, pandemic, as they say, meaning worldwide epidemic. And there was a tendency for a while to people kind of downplay this a little bit and try to say, oh, this isn't any big deal, it's no worse than the flu. Well, that's clearly not true. We have a virus that's really incredibly well suited to spread, and that has a pretty significant death rate, and particularly a high death rate among the older population. It has an unusually steep gradient in terms of the death rate, being essentially none in children and even very, very low in young adults, but pretty high, maybe a 10% death rate in affected older adults. So it clearly needs to be taken seriously, and I think now we're really beginning to see government locally and statewide taking this seriously. I think what we're seeing now in the Bay Area, where they've just announced essentially what amounts to a near lockdown of a shelter-in-place kind of order, except for real essential movement in the Bay Area. And I think likely we're going to come to something like that here as this moves more into this community. I don't even know if there's any new announcement about whether there are actually any confirmed cases yet in this community, but there's so much interaction between here and the Bay Area and the rest of the world. We're not going to remain an island. We're not going to stay isolated, and there will be cases in this community, and I had the good fortune to be at a presentation at the Board of Supervisors meeting that was done by the county health officer, and it was a really clear and well thought out presentation, where he talked about the concept, which we're seeing now, this pretty widespread, I'm seeing this pop up on social media and in news reports, and this concept of flattening the curve in the growth of the virus. And kind of a way to think about this, and these are imaginary numbers, these are not real numbers, but let's just to talk about these imaginary numbers for the sake of clarifying things. If we say perhaps that, let's say 10,000 people in Butte County become infected with this, and perhaps 1,000 of those people need hospitalization, and maybe 100 of those need intensive care and perhaps being put on a ventilator. If those numbers happen over a period of 3 months, then perhaps we can handle this with great strain. If those same numbers were to occur over a period of, say, 3 weeks, there's no way that we can handle it. We don't have anything remotely like the capacity to care for that amount of illness. And so the key now, we're not going to successfully prevent this from happening in our community. We're not going to prevent it from affecting a fair number of people, but if we can slow that process down, that's really key, both in order to mitigate the impact on the healthcare system, and to give us time to give the healthcare system time to learn more about it, time perhaps to develop, to learn whether some antiviral drugs work on this, to learn, I think a vaccine is still a fair ways away, but the more time that we can buy, the more we can slow the process down, the better it is by a lot. And so that's really where things stand at this point, is we need people to do the things that will help to slow down the progression of the epidemic.
So your patriotic duty right now to this country is to follow the rules, stay home. If you're older, stay isolated. Try to limit any sort of functions you have. 10 or less people is what I'm hearing now, but really, if we want to take on and we want to be, as I say, as patriotic as possible, we want to try to prevent because what you're saying is it's about our healthcare workers, our frontline defenders to this.
Yes.
And if we're overloading the hospital or we're putting healthcare workers at a bigger risk, we're really going to fall behind on this battle.
Right.
And so the mission right now is to make sure we in some areas shelter in place or take measures to prepare to be.
Yeah, really as little interaction with other people as possible should be a goal, I think, as we move, especially over these next few weeks as we move further into this process. And the earlier we start taking those actions, the better. One of the lessons from this is that particularly here in this country, I have to say we've been relatively slow for various reasons to ramp up our testing capacity for this. And because we are not yet testing people in mass numbers,
don't know anything.
We really do not know how widespread this is yet for example, in this community. But we have in general, you can do some calculations, and I'm not going to try to go through this in detail, but the public health people tell us that you can basically do some calculations from when you start to see people sick enough to be hospitalized with it, when you start to see the first deaths occurring with this, it means that this has already been circulating in the community for quite a while. And so it's there before we know it's there, and that seems to be a characteristic of this disease. And as I mentioned earlier, it's extraordinarily well structured to spread, because as best we know at this point, and I should say I am far from being a public health expert. This was not really my field, but I've been forced to learn some things about this, that this is a disease, unlike many others, that is contagious before it becomes symptomatic. And quite a lot of people, especially the very young, will have essentially asymptomatic cases of it. People who will be infected, but so mildly infected that they don't know they are, that they never get a very serious case of it, and yet can be infectious in terms of passing it on to others. So that's part of what makes this so dangerous in terms of its ability to spread. If you have a disease that doesn't become contagious until it's symptomatic, then isolating people who are symptomatic can stop the spread of the disease. But if you have a disease that is contagious before it's symptomatic, then it's really hard to know what's going on and really hard to stop it effectively. So that's why the emphasis on minimizing interaction between people, even if everybody in the room appears to be well, you could be spreading the disease among people who don't know they have it.
David, let me ask you a quick question, because
Sure.
the nature of a pandemic like this is that, of course, it's throughout the entire world. So health officials in the United States have had the opportunity to observe the Chinese response to this, the South Korean response to it, the Italian response, the Spanish response. And of course, there were mistakes made in many of those nations. Italy, in particular, is one where it felt as though when they closed down the northern area of the country, that was a really draconian step, but apparently it wasn't a draconian enough step. So are there lessons that health officials, do you think, can learn from a country like Italy?
Sure. I think the single biggest lesson is that the earlier you take strong actions, the better. And that's why even here in Butte County, where we have few if any known cases of it, it's not too soon to be taking serious action about it, because it's just, and I have seen, for example, graphs of curves that depict the progress of the disease varying depending on how soon you take action. And so the sooner you start practicing these social isolation type things, the more effective they're going to be, the better you're going to do at restricting the spread of the disease, slowing the spread of the disease. And so that's probably the single biggest takeaway, is the sooner you take action, the better. The Chinese were at first, clearly they made some really serious mistakes in terms of when doctors were first talking about this was a problem. For whatever reason, and it's not clear whether this was coming down from the national level or whether it was local officials, the initial reaction was to try and suppress that word and not let the word get out about it, which was really dumb. But once they got on board, they got extremely serious about the isolation and social distancing and all of that kind of stuff, and have very successfully, I think now, the epidemic there is clearly on a steep downslope, and the numbers of new cases are rapidly dropping because they finally, once they got going, took that really seriously and did it intensely, frankly, in a way that's hard to do if you're not in an authoritarian country. And so, they have a level of things like surveillance of average citizens that could be turned into disease fighting that we don't do here, and probably don't want to do here in terms of those levels of surveillance and social control. But they turned out to be handy for fighting an epidemic.
You mentioned something that was a point I wanted to raise, is risk versus reward. I mean, there's all these factors. I mean, in a perfect world, you could just shut everything down, but there's other factors involved. I mean, the idea of not having kids go to school is, in theory, a good one, but many kids get their one good square meal a day at school.
Yeah.
So,
Yep.
These are complicated issues. It's risk versus reward.
It absolutely is, and that ripples out through everything. And I think one of the things, and I've seen this as a social media post, which I think is worth reminding people of as this goes on, and that is, if you do all these things and you upset the normal routines of your life in all of these ways and pay the price of making all these changes, and it turns out not to be as serious as we feared, that was the point. That was why we did those things, because by doing those things, we've made it not as serious as we feared. And so we shouldn't look, no one should look back later and second guess and say, oh, we didn't need to do all that stuff, because it was doing all that stuff that perhaps may end up making it less serious if we do it well.
I'd like to switch to talking about frontline nurses and doctors in the battle here. Do you see what are they needing, and what's going right, and what are they looking to down the road here?
Well, I think the big worry right now at this stage of the game, at least in most places, our healthcare system is coping pretty well with what's happening. I'm hearing secondhand that in the area perhaps around Everett, Washington, which had a very rapid growth of a very intense cluster, that hospitals there may be somewhat overwhelmed, but that's only secondhand information that I'm hearing there. Locally, I think people are doing are doing well. Again, the issues though that loom on the horizon are that if this grows fast, and that's why it's important that it not grow fast, we could have some really serious shortages, not only of personnel, but of some of the equipment and supplies that we need. One of the things that's being an issue, this gets really a little technical, masks, okay? The standard surgical mask that we see some people wearing on the street is primarily designed to protect not the person wearing it, but to protect others from the person wearing it. So in other words, when the doctor wears that mask in surgery, it's to prevent the doctor's exhalations from getting into the surgical field. Okay, that's what that's for. It's not a particularly great mask for protecting against incoming, protecting the person who's wearing it. For that kind of stuff, you need much more elaborate protective gear. At the very least, the so-called N95 mask, which is a more expensive, more elaborate, tighter fitting mask that has to be specially fitted and so on. And then for really bad infectious diseases, like when people are dealing with Ebola patients, you're talking about a full respirator hood and hazmat suit and the whole 9 yards. If this were to ramp up fast, we don't have nearly enough of those kind of supplies, and we would run out of them if this ramps up before we can augment the supplies of it. We don't have nearly enough ventilators. The United States has fewer hospital beds per capita than many other developed countries do, so our hospital capacity would become overwhelmed more easily than some other countries would. So those are really some of the kinds of issues that we worry about. And of course, in places, we've had a few situations, for example, there was a situation, and this was a patient who had come off of a cruise ship that was cared for at a hospital in Vacaville, was cared for at that hospital, then transferred to another hospital, and all of that happened before they knew what the patient had. So he was cared for first in one hospital and then transferred to a second hospital, and was in the second hospital before he was diagnosed with the coronavirus. And I believe there are more than 100 healthcare workers who came in contact with that patient who are now on home quarantine and not able to work. So you can pretty easily radically impact your healthcare staff it doesn't take very much, and similar situations again happening up in Washington. And I gather there was that skilled nursing facility that has had a bunch of infections and a number of deaths at that skilled nursing facility. And I guess there were firefighter paramedics who were involved there, who are now off work and on home quarantine. And that has a huge impact on that system. So I think there's really three potential areas that we could really end up in problems again if the epidemic grows rapidly. And those are shortages of healthcare personnel, perhaps most importantly, shortages of critical supplies like masks and some of those things, and then shortages of critical equipment like ventilators. Those are the areas that things could go badly. At this point locally, there's no huge impact yet at this point locally, but that's where the worry is.
Mm-hmm. David, can I ask you a question? I hate to inject politics into this discussion, but it's part of our life these days. Many things revolve around politics. So we are in the middle of an election. We're running an election now. The Democratic primaries are active, and not so much the Republican primary, but certainly the Democratic primary. So how does this affect, and how should this affect that very important task that we also undertake as Americans? Should primaries be, in your mind, eliminated or put on hold for the public good, or is there a broader import?
It is really hard to know because, if we had a situation, it's honestly hard to come up with what is the right answer to that, because on the one hand, there are sort of relatively rigid timelines when you think about you've got an election in the fall that presumably is going to happen, and you need time ahead of that to campaign. That means you need to establish who the nominee is by a certain point. And in order to establish who the nominee is, we need to get through the whole primary process. And in theory, it might be nice to switch to all-mail voting for this, but the reality is making that switch is very, very difficult to do. We saw here in Butte County that we just went to a theoretically all-mail election where everyone got a ballot in the mail. And that process was unfamiliar to so many voters that there were some, even though by and large people were able to vote and so on, and votes got counted, there were still a lot of problems and a lot of glitches along the way. And I don't blame elections officials for that. I think it was largely a matter of voter unfamiliarity with the process. But if we tried to do that with less notice on a shorter time frame, I can't imagine how we could do all-mail elections successfully. So I don't have a good answer on that one. You know, it's critical to our democracy that we do this, and yet this is not a good time to be bringing people together in large numbers in a lot of places. And of course, the population that votes most consistently and is most accustomed to going to the polls to vote are the older population, who are the people most at risk in this epidemic. And so, big problem. I don't have a good answer.
How about a convention in Milwaukee in July? I mean, what happens if you can't do that?
Real problem there. I mean, that could be managed. You know, this is a much smaller event, but the state Democratic Party was scheduled to have a large meeting next weekend where we were going to be electing members of the Democratic National Committee, and that got switched over to an all-mail, you know, a vote-by-mail balloting. And I think that could be done for something like the National Convention. It would be very difficult to do, it would be challenging, but I think it could be done. But to transition what's still almost well over half the states that have not had their primaries yet, to transition them on very short notice to some other way of voting than in person would be incredibly difficult to do, and I don't really believe could be done successfully. So I don't know what the correct answer is there.
Yeah,
that's
we have
really tough one.
We have a national census in progress too. That's going to be very difficult.
And yes,
door to door when people aren't going to be very responsive to.
And of course, the goal is to try and get people to respond to the census in other ways and do as little of it as possible door to door. But we just know, again, that a fair bit of it is going to have to be done door to door by census workers, because there are going to be a fair number of people who don't respond by, they're offering for people to respond by mail, online, or by phone, and yet there will be a fair number of people who, for one reason or another, don't respond in any of those ways, and they're going to have to get a visit. And the census is pretty critical for the functioning of our democracy, because our apportionment and much of our government funding and things like that is based on the census. So that's another critical government function going on right now. And from my personal standpoint, the fact that we have a president and a national administration that has some authoritarian impulses, and that has not been where competence has not been highly valued in that administration, certainly makes some of this worse.
Well, they're believing in states' rights right now, for sure. But I know seeing Governor Cuomo today kind of announcing that they're going to need the federal government's help.
Yeah.
But transitioning into the economy just for a minute, because that's what we've also seen on the economic side, if I may, Mikey. Mm-hmm. The Fed kind of exasperating all the tools in their toolbox to sort of help out the downward spiral of the economy, and mm-hmm. now they have other tools, but they have to deal with the social net in the form of giving some tax relief to people, giving some every monthly bill relief to people, but also helping people who have either lost their job or are looking at an unknown time off work for this.
Yeah.
Romney came out today suggesting a $1,000 stimulus to people, but you see other countries and what they're doing, kind of to relieve some of the, some of the anxiety in it, is saying, I think Canada has gone on to pay everybody's mortgage and block any utilities from being put in.
Yeah,
So,
I haven't seen all those details, but what is really clear is that this exposes, an event like this exposes every weakness in a society. It brings out weaknesses that have been there, that have been obvious to some people, but not obvious to everybody. And things like the fact that we are pretty much, I think, the only relatively wealthy developed country that does not have any sort of mandated paid sick leave for workers. And that a great many of the workers perhaps most of the workers who don't have paid sick leave are low-wage workers who live paycheck to paycheck, who really depend on every paycheck coming through in order to be able to buy food and pay their mortgage and things like that.
To have healthcare, yeah.
So that's a really critical issue. Putting on my union hat for a moment, we're exposing the fact that people who work in unionized workplaces in the United States mostly do have some paid sick leave and some job protections and things like that workers in non-union workplaces don't have. And again, that's kind of exposing some of that. And I think where there are being weaknesses in the healthcare system, I think my union, or Nurses Union, the National Nurses United, California Nurses Association, has been a pretty effective voice around pushing hospitals to do what needs to be done to protect workers. And we're starting weeks ago to call attention to some of the weaknesses in our system and some of the things that needed to be shored up in the system. And I think our union has been one of the most effective voices in doing that. And again, it helping to show people the value that a union has in those kinds of situations.
Yeah, it's striking to me, if you're going to ask for closures for restaurants or casinos or anything, that you sort of have a plan for the workforce too, in that regard. But looking locally, there are some businesses I've seen on social media or otherwise that have said, well, this is just voluntary. I'm not going to go with that. We're going to keep the doors open. I saw something with a casino up north where they just closed machines between each other, between a couple people, to create more of a social distancing technique. But what do you say to the business owners out there who maybe are on the fringe with who to listen to on this?
Well,
or do pull a political leaning and aren't thinking about this outside of politics?
Yeah, it's really tricky, and it is hard to say. I mean, when I think about trying to look at a practical level, if you've got a restaurant that's only doing very light business, but you want to keep it open, and you can use that light business to keep people well spaced apart, maybe that isn't the worst thing in the world to do that. But to invite people to come congregate in a bar, which is just naturally a kind of a place where people tend to be close together and tend to congregate, that just doesn't seem like a good idea. Or to put on musical events, things like that, that just doesn't seem like a good idea at all to be doing that sort of stuff. I think, again, I just want to keep emphasizing that by the time you see the epidemic present in the community, it's been there a while. It's been there before you see it. And that's just all the indications we have about this stuff. And so if you wait until we know it's here to be taking some of these more extreme actions like closing businesses, that's really too late to get the most benefit out of those. You get the most benefit out of those actions when you take them before it seems obvious that they're necessary.
Yeah, and I just want to say, Mikey, to help, anxiety is to prepare, and to prepare well. If you don't have anything, let's talk a little bit about what we eat and how we can even prepare our immune system for something that might be coming. I mean,
ooh. Well, I'm not the expert on that, but it is interesting, though, that we're not seeing the stores run out of fresh fruits and vegetables or anything like that. You know, people are stocking up on, they're sort of doing this apocalyptic stocking up on, you know, the shelves of canned goods are all empty, but there's still plenty of fresh fruits and vegetables there, and that's actually probably the healthiest thing that we should all be eating in terms of keeping our immune system healthy and things like that. And, you know, having spent my career in cardiac rehabilitation mostly, I would say that one good thing you can do that's a completely responsible, good thing to do to get out of the house is go out and take a walk. You just do that by yourself. You don't interact with anybody. You're not going to spread any diseases or catch any diseases going out and taking a walk for a while. It gets you out of the house and helps to keep the blood circulating and keep you healthy. So
we could still be good neighbors in our community. I mean, let's say, I'll give you a scenario. Let's say I have an old couple across the street. They are going to go into a shelter in. They're going to go to, you know,
a self-isolation.
How can I go about helping them, being a good neighbor? Can I write them a letter and say, hey, anything I can do to help out?
Yeah, I'd call them on the phone or whatever means of communication you have easily, and say, hey, you know, you folks are high risk. If you need somebody to go to the store for you and bring home a box of food and put it on your front porch, I can do that for you.
A nice big lasagna, yes.
Yeah. So I think that's a reasonable thing to do, particularly when you're aware of high-risk people in the community who maybe don't, especially people who don't have close family around to help them out in those ways. It's, you know, it's like isolation is something we want to do. We want to do our social distancing and avoiding congregating in groups. But on the other hand, people who are isolated in the sense of not having much of a support system become more vulnerable. And of course, maybe when we talk about vulnerability, we're telling people to stay home, but we have this population that doesn't have a home to stay in, and that doesn't have access to, you know, who may be sleeping outside in bad weather, who don't have access to healthy food and things like that. I mean, this is really a vulnerable population, is our homeless, our unhoused population. Those are folks who obviously have the potential are at high risk of getting sick and at high risk of perhaps, again, overloading the healthcare system, spreading illness to others. So I think this is really, once again, as I say, it's exposing the weaknesses in the society. It's exposing the fissures, exposing the places where we're fragile in various ways.
Yeah, and it does, because, you know, you mentioned that, and I think that there's definitely a schism in people who are, you know, more right-leaning, more conservative followers of President Trump. People who voted for President Trump tend to give less credence to this advice to self-isolate, and to have social distancing. The other part of that was interesting to me was the debate we saw the other night between Bernie Sanders and Joe Biden. You know, you could see Bernie Sanders really trying to make that case that it's an event like this which tells you that changes are needed, where Joe Biden was much more taking the tack that, well, what you're saying isn't wrong, Senator Sanders, but now's not the time to deal with it. Yeah. So there's a lot of those cross currents that are blowing in society, and it's a complicated 330 million person country. So that's yes. Inevitable, I suppose.
And I will say, in finally, belatedly, but I was listening to a presidential press conference today, which is not only with the president, but with a number of senior advisors and the senior people in the CDC and things like that, in which we are finally hearing him acknowledge the seriousness of it and encouraging people to take the advice of the healthcare professionals and the infectious disease professionals. So I think that's finally a very good thing. It was coming late, but hopefully that will help some of the people, because we have seen this current of, if among a subset of conservatives who are saying, if liberals say this is a serious disease, it must not be. So I'm going to ignore that. And so I'm glad to finally hear the president saying things about taking this seriously, even though I think that should have been said somewhat sooner.
Yeah, and I'm hoping to see worker relief come this week too, in the whatever form it takes. I know Nancy Pelosi has got several things in a bill and it's being negotiated.
Yeah, there's work being done there, and I think that's important, and again, in some ways probably too limited, and would have been nice to have it sooner, and all of those things. But again, I think some important stuff is being done there. It's really critical that we know that in any kind of economic downturn and things like this, the things that will actually do the most to help that economic downturn are putting money in the hands of people who will spend it immediately on necessities. That's where money makes the biggest difference. And so doing things that help to meet the essential needs of people in the lower end of society, the low-wage workers and so on, who are being put out of jobs, everything from motel maids to restaurant workers to whatever, who are in those lower wage strata, those are the people that we have the most urgent need to really take care of. The stock market drops, stock markets go up and down, but taking care of the needs of those low wage workers is really some of the most critical stuff. And then again, the people at the very lowest end, the unhoused people who have real potential for not only being at terrible risk themselves, but increasing the risk to the rest of us because of the fragility and the bad situation that they're in.
Seeing that, Mike, just seeing if they came out today and said, hey, 2 weeks sick leave paid, 4 weeks sick leave paid, I mean, how many lives would that save lives at the end of the day?
Yeah, I think so.
No question, sure. I think so, sure. Yep, absolutely. Yeah. And there's political will to do it. I think that's where we're at right now, is this idea that, we strike now and hopefully this establishes a precedent where, paid leave is just a thing that, like most of the rest of the developed countries in this world, we offer it to our workers, regardless of where they are in the structure of the work environment, the work economy. So I think that these are values that, I think I'm of two minds with it. Yes, it is an emergency, and yes, we need to take care of the most important matters right now, but we also have to, I think, bear in mind what this has shown us, which is that there are huge disparities. We knew it already, but it's really bringing it into very sharp relief, the disparities and the way that people, working poor, people that are not on the streets necessarily, but are just one paycheck away from being on the streets, and whose kids are maybe depending on that lunch for a lot of their nutritional value during the course of the day, who maybe won't get that at school now, and maybe they have to now be home to watch their kids, and their entire economic life now, that house of cards, which is so fragile, is now just going to fall apart, and it's going to happen so quickly. Yeah. And I think that's important to remember too.
And there's so many people in our society today, particularly in service industry type workers, who are that fragile, and who are very much on the edge financially, hardworking, good people raising families, but who have just no margin for error. If you wouldn't mind, I'd like to kind of circle back a little bit before we end this, to just talk a little bit again about personal actions, because one critical one that we didn't talk about, we talked about the importance of social distancing and not interacting too much with other people. The other really big one is hand washing. I just want to make sure that we don't fail to emphasize that, because it appears that most transmission, again, there's a lot we don't know about this disease, but what we know about other similar diseases is that transmission primarily happens when a person with the disease exhales droplet nuclei that contain viral particles. Those settle on surfaces, you touch those surfaces, and then hands go to mouth, eyes, nose, and that transmission happens. It's not primarily that you inhale the disease from someone by being near them, it's that you pick it up off of surfaces that those droplets have exhaled onto. And so frequent hand washing at pretty much every opportunity you get, frequent, thorough hand washing, taking 20 seconds or so, which doesn't sound like a long time, but it's a lot longer than most people spend washing their hands. And taking the time to do that and do that properly is really still one of the most critical things we can do. On the occasions when you do have to go out into the world, when you do need to go to the store to or make other kinds of critical trips to do things, doing hand washing at every opportunity you can is pretty important to do. When you come back, I've schooled myself now. The first thing I do when I come back into the house is wash my hands. And then once I'm in my home and I've washed my hands, then I can sort of feel like, okay, now I can relax and I'm out of that out of that zone of needing to take precautions about everything. But I think that's when you're just taking every opportunity to wash your hands thoroughly is one of the most critical things we can do.
And David, that will also help just your regular run-of-the-mill influenza and the common cold as well.
Yes, and of course numerous other diseases. That's again, when your mom taught you as a kid to wash your hands after using the bathroom and all those things, that was really important to do. we don't do it good well enough. Yes, but it's good all the time. But it's more critical now than any other time. So the social distancing, the hand washing, avoiding unnecessary interactions with other people, pretty much. Certainly avoiding large group gatherings. I absolutely appropriate that musical performances, things like that, really shouldn't be going on at this point with live audiences, congregating in bars, probably even in churches, political meetings. I've canceled the meeting, a monthly meeting that I normally run has been canceled, things like that. So we need to take this stuff seriously, and once again, if we take it seriously and it turns out that it wasn't as bad as we thought, it wasn't as bad as we thought because we took it seriously and because we did those things.
Just wanted to talk one more time about risk factors and some of the people, and you worked on the cardio side of so I've heard people with heart disease can be a little more susceptible.
Of course, people with lung disease, and it seems, again, we're still in a learning curve about this disease, but almost all respiratory diseases hit smokers or former smokers harder, and it seems like this one is more so than most, that the differential seriousness for smokers is even more so than for a lot of other respiratory ailments. And so people over 60 and particularly people over 70 are at higher risk. Smokers, people with heart disease, people with chronic lung disease, people with diabetes, all at significantly increased risk. And again, the young, not at high risk for themselves, but danger of being vectors to others. So the implications for things like a lot of families where grandparents do childcare while the parents work, that's a pretty serious issue. So that might be something to try to avoid, if at all possible.
All right. And I know you're not a financial advisor, but you did give a little financial advice earlier in the day. It's like, stay calm, your recommendation to other retirees like you is sort of just kind of let the market do what it does. It goes up and down.
When the market's doing gyrations, people who panic sell during times of market drops, that's a really bad move to do that. That's converting a theoretical loss into a real loss. Markets go down, markets come up again.
Retired but always willing to serve, I know. Is there talk around nursing groups and retirees that you might be being called back to duty?
I haven't heard of anything like that yet, but if things get like they got in Italy, we might be there, because I do think their system got rather overwhelmed there, and where critical nurses, emergency room physicians, so on, were working some ridiculous amounts of hours and things like that. So who knows? But let's hope not. I'm enjoying retirement.
And again, listen to our local leaders and our local officials, and going off of what the state center's emergency management office says. So, Mikey.
And one thing I would recommend, if I'm a total amateur, but I'll put this out there, do mindfulness. I mean, I think that, turn off the news. Many of us are going to be at home for a long period of time. We're going to have access to the internet all the time. Turn it off.
Yeah,
great point.
If you can go for a walk, if you can just breathe, do some mindfulness, because the stress is bad too. And the stress also, many studies show, does also impact your immune system. So try to relieve your stress if you can as well.
Pick up that book you've been meaning to read for a while.
Absolutely.
Yeah, go to the park.
Don't over immerse yourself in stressful news for certain.
Yeah. If you don't have to, exactly
watch
right.
the humor. I'm always saying, try to find the humor, and so keeping it light in the household, especially if you have kids around. You'll want to make sure to keep anxieties low. I think children are going to be anxious in this time, and humor can be a great way to cope with things in a rough time. So.
Yep.
All right, Mikey, you want to send us off? I think we'll probably wrap it up here. We want to really thank David Welch, and thank you, Mikey, coming in from Florida.
Hey, no problem. It's my pleasure. And yes, thank you, David. Thank you for joining us today on the show. Always a pleasure to have you with us, and really appreciate your very unique perspective on healthcare and politics. And the combination of those two things, a great nexus of information there for our viewers. So thank you for doing that, David.
All right, my pleasure.
Yep. Also, of course, we want to thank our sponsor, the North State Labor Federation, AFL-CIO, which promotes social justice for working people in our community. For more information, visit online at northstatelabor.org. So thanks to you all for joining us today on NorCal News Now. We'll see you next time for another episode soon.